Hello, my name is Dr. Farman Ali and I am a GP family physician. Today we will be talking about a very common female problem known as menorrhagia. So what is menorrhagia? The National Institute of Clinical Excellence defines heavy menstrual loss as excessive blood loss that interferes with the woman's physical, social, emotional and/or quality of life. It is difficult to measure blood loss accurately because different people have varying perception of their blood loss. However, a normal blood loss of 30 to 40 mL during a period is considered as normal. This equates to approximately 6 to 8 teaspoonfuls of blood per month. Now, bleeding can last up to 8 days, but normally 5 days is an average. A heavy period is blood loss of over 80 mL, that is twice the amount of normal blood loss. However, it is difficult to assess that and you have to take a full detailed history from the patient. For practical purposes, it might be worth asking the patient, does it flood through to the clothes or bedding? Do you need frequent changes of sanitary towels or tampons? Do you use sanitary protection, both tampons and towels together? Does it soak through to bedclothes? Whether you pass large clots? Restriction of a normal lifestyle because of heavy bleeding. So let's go through some definitions. Menorrhagia. Menorrhagia means heavy periods that recur every month. Polymenorrhea, it is a bleeding at intervals of less than 21 days. Dysmenorrhea, on the other hand, means pain with menstruation. So what are the causes of menorrhagia? In 40 to 60% of women who complain of excessive bleeding, there is no underlying pathology or problem, and this is called dysfunctional uterine bleeding, abnormal bleeding without any obvious structural or systemic pathology. So the diagnosis of dysfunctional uterine bleeding can only be made once you have ruled out all the other causes for abnormal bleeding. In short, the womb or the ovaries are normal. This is not a hormonal problems. Ovulation is often normal and the periods are usually regular. Heavy periods due to the dysfunctional uterine bleeding seem to be more common in the first few years of life, starting periods, and also in the months running up to menopause. At these times, you may find that your periods are irregular and heavy. If you are a teenager and you have heavy periods, there is a good chance that they will settle over a few years and become less heavy. So what are the causes of menorrhagia? Fibroids. These are non-cancerous growths in the muscle of the womb. They often cause no problems, but sometimes cause problems such as heavy periods. Endometrial polyps. These are small fleshy lumps called polyps. Endometriosis. This is the presence of uterine tissue outside the cavity of the womb. Adenomyosis. Invasion of the muscle of the uterus by endometrial tissue. Endometritis, which is an infection of the lining of the womb. Pelvic infections. There are different infections that can sometimes lead to heavy bleeding. For example, chlamydia infection can cause heavy bleeding. These infections can be treated with antibiotics. Endometrial hyperplasia or cancer of the womb. Endometrial cancers, they present in women above the age of 50, and these are patients who have gone through their menopause. However, Some cases present with abnormalities with normal menstrual cycle. However, some cases present with abnormalities of menstrual cycle alone. 90% present with abnormal uterine bleeding in some form. An intrauterine contraceptive device or anticoagulation treatment can increase a menstrual flow. The intrauterine contraceptive devices such as coils can cause heavy bleeding. However, a specific hormone releasing intrauterine device, also known as menorrhagia coil, can actually treat heavy periods. So, what are the causes outside the body of the uterus? Systemic diseases such as hypothyroidism, which is underactive thyroid, liver or kidney problems, obesity, and bleeding disorders, for example, von Willebrand disease. Hormonal problems. Periods can be irregular, and sometimes if women do not ovulate every month, the periods can be heavy, such as those women with polycystic ovaries. Women with underactive thyroid also have heavy periods. Warfarin or similar medication that interfere with blood clotting. If you have one of these medication for any conditions, the periods might be heavy. Patients on chemotherapy can have heavy periods. Blood clotting disorders are rare causes of heavy bleeding. So, we come to the diagnosis. First and foremost, you need a good detailed history and examination of the patient. If you keep a diary, it will help your doctor to ask the relevant question and assess the severity of your condition. The doctor should do a general physical examination and check your BMI, which is the ratio between your height and body weight. Signs of hirsutism, which is excessive hair on the body, and anemia. Examination of the abdomen is required, otherwise one can miss large pelvic masses. When relevant, please ascertain that cervical smears are up to date. Now, vaginal examination, it may not be necessary, but if indicated, the clinician should inspect the cervix and takes swabs at the same time. They will perform a bimanual examination to look for abnormalities of bulky or grossly enlarged uterus. However, this examination, as I said, may not be necessary, especially in younger women who do not have any symptoms to suggest anything other than dysfunctional uterine bleeding. We move to the next part of the investigations. Usually no investigations are required. If vaginal examination is normal and there are no associated symptoms, no further tests may be necessary. The diagnosis can safely be made of dysfunctional uterine bleeding and treatment may be started. Further tests for some women, especially if there are concerns that the heavy bleeding is due to underlying cause, may be necessary. So what are those further investigations and when are they required? If a patient is having intermenstrual bleeding, which is bleeding between periods, or have irregular bleeding, dyspareunia, which is having bleeding or pain during or just after sexual intercourse, pain, having pain apart from normal period pain, vaginal discharge, if present, would require further investigations. Have any change to your usual pattern of bleeding, having symptoms suggestive of an underlying hormonal or blood disorder. So the type of investigations that are required. A blood test is most commonly required to check for anemia. If the bleeding is heavy, you might be lacking in iron and you may require supplementation for that. Up to 2 in 3 women with recurring heavy periods develop anemia. Also, you have to check for thyroid problems, which can only be done with a blood test, as well as bleeding disorders. Ultrasound scan of the womb. The probe of the scanner is usually placed on the tummy to scan the womb. There is another small probe that is placed inside the vagina to scan the womb from that side. The ultrasound detects any changes in any fibroids, polyps, or any other changes in the structure of the womb. As mentioned before, internal swabs. This may be done if an infection is suspected cause of heavy bleeding. A swab is taken, it is called a high vaginal swab. The samples are then sent to the laboratory for further testing. Endometrial sampling. This is a procedure when a thin tube is passed into the womb and a gentle suction is then used to obtain small samples or biopsies of the lining of the womb. This is usually done without any anesthetic. It is called a Pipelle biopsy. The samples are looked at under a microscope by a specialist to look for any abnormal cells. Hysteroscopy. This is a procedure in which a doctor can look inside the womb. A thin telescope is passed into the womb through the cervix via the vagina. This too can often be done without any anesthetic. Small samples can then be taken and sent off to the laboratory for testing. So, do you require a referral to a specialist? This is decided by the presence of the following factors. Intermenstrual bleeding, symptoms that have not improved with medical treatment, women who are aged over 45 years with heavy menstrual bleeding, and history to suggest that there might be underlying endometrial pathology. If an abnormality is suspected after an abnormal physical examination, apart from, of course, fibroids which are less than 3 centimeters in diameter, women with risks or signs of cancer, and these women are referred via a 2-week pathway for an urgent assessment. There are some other indications, such as those women who wish to be considered for surgical treatment and women who have iron deficiency anemia that is not responding to the treatment. We come to the treatment options for menorrhagia. One is no treatment but wait and see. This is an option if your periods do not interfere with a normal life. A blood test may all be that is required to check for anemia, and iron supplementation is done. Levonorgestrel intrauterine systems, or commonly known as Mirena coils. This works for 5 years and slowly releases a small amount of progesterone into the womb. This progesterone is called levonorgestrel. The amount of hormones is quite small and it is secreted locally into the womb. In most women, the bleeding either becomes very light or stops altogether within 3 to 6 months. Periods pains is also improved with this treatment, and this is a very effective method of contraception as well. Tranexamic acid tablets. Treatment with these tablets can reduce the heaviness of the bleeding by almost half in most cases. However, the number of days of bleeding during the period are not reduced, and neither is the period pain. You need to take 3 to 4 tablets for 3 to 5 days during the period. Tranexamic acid works by reducing the breakdown of blood clots inside the womb. It strengthens the blood clot in the lining of the womb, which leads to less bleeding. Anti-inflammatory painkillers. Ibuprofen can be purchased from the pharmacies, but your GP can prescribe mefenamic acid or naproxen. This can reduce the blood loss by about a quarter in most cases. These also ease the pain. You need to take the tablets for a few days during each period. They work by reducing a chemical called prostaglandin in the lining of the womb, which seems to contribute to heavy periods and period pain. Again, they do not reduce the number of days of heavy periods. The combined oral contraceptive pill, this reduces bleeding by at least a third in most women and reduces period pain too. It is most popular in women who also want contraception and those who are not keen on having a coil. If required, you can take this in addition to the anti-inflammatory medication. Long-acting progesterone contraceptives, these include the implants or the injections that are given for contraception. For example, up to half of the women on contraceptive injections have no period at all after a year. They are not given as a treatment for heavy period. However, if women choose to go on contraception, this might be an option to consider. Northisterone is a hormonal progesterone medication. It is sometimes considered if other treatments have not worked, or unsuitable, or not wanted by certain patients. Northisterone is not commonly used as a regular treatment because it is less effective than the other options that we discussed. Also, many women develop side effects from it. However, this is very effective. It's a temporary measure to stop very heavy menstrual bleeding. Sometimes a combination of these treatments may be required, provided they work via different pathways. Surgical treatment for menorrhagia or heavy periods. Having surgery is not the first line treatment. It is an option if all of the above treatments have failed or not suitable. And there are two types of surgical treatments. Endometrial ablation. This is basically removing or destroying the lining of the womb. This is called endometrial ablation. This can be done in a number of ways, using heat, lasers, or energy waves. It can be done by passing an instrument into the womb through the vagina, or can be done through the tummy using ultrasound or MRI scans. These guide the energy waves to the right place. The aim is to remove as much of the lining of the womb as possible. This is usually very successful, but sometimes it needs to be repeated as it is not a permanent method. Hysterectomy is a traditional operation where the womb is completely removed. However, hysterectomy is done much less commonly these days. This is since the availability of endometrial ablation in the 1990s. It is a major operation with more possible problems and complications and longer recovery time. However, it may be considered if all other options have not worked for the patient. Thank you very much.